Welcome back, Richard. It's already the start of the last week of January.
And
Was
it you the other day who said it's already the third week of January? It's like we just had New Year's Eve or something.
I know time is going by quickly, and so many things have happened. So many things are going on just in this first month of the new year.
Right.
So many things have been happening, and some of it's politically based, some of it is pandemic based.
Mm-hmm.
But today we're going to talk about a very interesting report that has come out in a couple of different sources over the last few weeks, talking about mental health and sort of the consequences from the pandemic as it relates to mental health in kids.
Right, especially school-age children. Right.
Yeah, these numbers are fascinating.
Right.
So
Yeah,
talk a little bit about that.
we talk about keeping, mostly in the news you hear about schools need to reopen. We have to get kids back to school, and there are different reasons why we want to do it. But when you read these articles about the mental health implications of kids not being in school, it is really alarming. And I was not a proponent of opening schools because I was convinced that it was going to make things infinitely worse.
Right.
It hasn't been as bad as we had predicted. And so from a mental health standpoint, though, these kids who are not in school, who had pre-existing mental health conditions, this has really been a significant struggle for them.
Absolutely.
And I think it's one of the articles is titled "Partly Hidden by Isolation, Many of the Nation's School Children Struggle with Mental Health." And that's exactly what's happened. Because we don't see them, because we're not aware of it, children and their families are struggling with mental illness.
Yeah, absolutely. And we'll dive into some of this in a few minutes, but we've talked so many times before on the podcast about the importance of relationships and that socialization for us as just as humans, how important that is. And so especially in young kids, but once they reach middle and high school, those social relationships and that social engagement is critical to healthy development. And you're absolutely right. When that's removed, there's a lot of consequences, and sometimes we don't see those consequences until much later.
Right.
And it may be difficult to make that connection. But when we make a close look at everything, yeah, it's not very good.
Right. Yep. And so we have a worsening crisis. But when people talk about a worsening crisis, mental rates of mental illness were increasing prior to the pandemic.
Right.
Now, when you and I used to do talks a few years ago, we routinely said about 5 million students had mental illness. Now that number is closer to 8 million children between the ages of 3 and 17.
Right.
So we know rates are going up.
That 5 million figure comes from the fact that there are about 50 million school-age children. And when we think about mental health conditions, about 10% or so of kids, of all of us, would meet criteria for a mental health condition that significantly influences or affects our overall functioning.
Right. So those,
it would take 5 million would be the statistical estimate.
Right. So those numbers were increasing prior to that. And we knew that suicide rates had reached a record high prior to the pandemic. Right. Now suicide is the second leading cause of death in the 10 to 24 age group. And there was just in 2019, there was a 40% increase in high school students reporting persistent feelings of sadness and hopelessness than there was the decade before. And so these numbers were already increasing
Right.
Prior to the pandemic. And when experts began looking for the cause of this increase, they were looking at things like social media, cell phones, disconnection from real interactions, and importantly, a lack of sleep. So there were many different explanations for why rates of mental mental illness were increasing.
Right. And we would encourage any listener to go back and listen to some of our previous podcasts about some of that, because especially, do a search for social media, because we had a couple of podcasts where we talked about, the reality that some research has demonstrated that the more you use social media, the lonelier the person reports feeling. And so, and again, there's a very tight connection between mental health issues, especially depression and anxiety and those kinds of things. Very close connection to those symptoms with loneliness.
Right.
And so the more you use social media, the lonelier you feel, and the lonelier you feel, the more depressed and anxious, and the more you might struggle with those mental health conditions. It makes sense that there's this increase that goes along with the increased use of social media.
Right. And we know about lack of sleep and sleep deprivation and all that. That goes without saying. So kids are not sleeping as much or as well as they once did.
Right.
And you forget that when a youngster has a mental illness, the youngster and the family learns how to use community-based resources, and especially schools, to manage the mental illness. It's sort of, we've said many times, school keeps you on schedule. Kids have to get up in the morning to go to school, so they have to go to bed at a certain time to get up at a certain time. School really structures your life. As much as we complain about education, the quality of education, boy, we've learned in this pandemic that it plays an incredibly important role in everybody's life. Parents can work because their kids are in school. And so school became this place where kids were able to go every day and see their friends and talk to teachers. And if kids were being abused, signs of physical abuse appeared at school. There were resources at school that kids could use if they were being bullied, if they were being abused, if they were struggling with anything. And suddenly that was all taken away. And these kids and families who had been relying on school as a resource suddenly were without that kind of support. And it's had a devastating effect on mental health.
Here in Florida, there's a system in place, following the school shooting at Marjorie Stoneman Douglas. There's a new act here in Florida that provides some additional funding and resources, but also created some systems that were put in place so that schools are informed whenever a student, a school-age student, is Baker acted or is hospitalized for mental health conditions. And it is alarming, the number just in the school. I only have a few schools that I'm privy to information, but it is amazing the fact that even though there's more students at school, in the school building, traditional school setting, even though there's more students there, the vast majority of students that I've been involved with who were Baker acted and everything, the vast majority of them are e-learners. They're students who were Baker acted or hospitalized from home because of suicidal ideation and self-harming behaviors and things like that. So absolutely, the concern is that when you removed, when the foundation and the stability and the consistency of school was removed, there was that initial, I think a lot of students had that initial, yay, I'm really glad that school's out, where there's no school, I can stay home and, play video games or whatever. But over time, it really has played a toll on these kids' mental health.
Yeah, it really has, and I think that was certainly an unintended consequence of closing the schools. It was also an unexpected
Yeah.
consequence, and I think what we've learned here is that of all these community resources, maybe none is more important than our schools,
Absolutely.
for what they provide for kids.
Yeah.
So we also have a worsening crisis now. We were already headed in the wrong direction, and now we have the pandemic.
Yeah.
And the pandemic has worsened everything for everybody, of course, and it's created some new problems. The biggest, of course, was to contain the virus. We implemented a three-pronged approach. One, it was social isolation,
Mhm.
became a problem, and then loneliness because of the isolation, but then also changes in routine.
Right.
And I think the changes in routine, I think, has affected almost everybody.
Absolutely.
People who don't go to work anymore.
Absolutely. And I think that, um, people, I think many people underestimated what it meant
Mhm.
because to be isolated at home or
Right,
to, for, you know, for all intents and purposes, to homeschool your kids.
right.
You know, we are accustomed, and this may
Mhm.
be, some people may not like to hear this. We are accustomed to our spouses or our partners and our kids being away from us for about 8 hours a day, at
That's
least.
right. That's right.
And so now all of a sudden, when we're in the same home, in the same small space for 24 hours a day, and there's not really any way to safely get away from each other,
Right.
um, that takes a big toll on people. Not
Yeah.
just the change in routine of getting up in the morning and going to work and everything, but
Mhm.
just the um, unending um, everything. The barrage of questions and behavior and everything else. It just doesn't end.
What we're going to make that point somewhere in this. We talk about we grew accustomed to being away from each other for part of
Yeah,
the day. My kids would leave the house, and
right.
everybody would leave the house, and we go someplace else, and then we come back and get to know each other again. And one of my older children, I was talking to him on the phone, and I said, "Imagine when you were a teenager, if you were stuck at home." And I don't mean this in any way, but I said, imagine if you were stuck at home with your mother, because he lived with his mother for part of the time. And he said, I wouldn't have made it. He said, we would not have made it if we were stuck in the same house day after day after day.
Mhm.
He said it would have been a very difficult experience for both of us.
Would have driven each other crazy.
That's right. That's right.
Yeah.
It was this ability to leave every day
Mhm.
and get out and see your friends.
Right.
So,
And again, you see it from parent to child, but you also see it between the parents,
right.
or
Mhm.
partners. Um, you know, it's very different.
Right.
People, it's very different to work with or to be with your partner all the time.
Yeah,
Um,
sibling rivalry.
right.
Every day is like a Saturday. Because they're together and they're working on each other and they're fighting and arguing. And
Mhm.
yeah, it's a huge problem,
Yeah.
right? So you have social isolation, loneliness, but changes in routines. And then you have what happens, on a hurricane day. Well, up north we had snow days, but
Right.
at least you could go out and play in a snow day. Here everything's closed. You have to wear masks, you have social distancing. They closed down kids' activities, dance classes, music classes,
Parks.
gymnastics
Parks were
classes,
closed for a
everything
while.
shut down.
Mm.
There was nothing for anybody to do. Even if you wanted to leave your house, there was no place to go. Playgrounds were closed.
Yeah.
And you had online schooling and the social isolation that brought. And so you have these kids who are struggling with emotional and behavioral difficulties, and they're kind of left to struggle on their own, to manage as well as they can on their own.
Right. Yeah. And
Right.
when you talk to those kids, or when we meet with them, you can hear it from them how
Mhm.
difficult it is to not have the release or the structure or the
Mhm.
just the respite
Right.
of distraction alone from
Right.
school and from classmates and things like that.
Now, some kids, when this whole thing hit, they were happy to stay home,
Oh,
not
absolutely.
just temporarily. Kids who were bullied at school,
Mhm.
kids who had social interaction problems at school, they were happy
Right.
to stay home. Kids who have OCD,
Mhm.
kids who have phobias, they were more than happy to stay at home, and some of them have done much better being at
Absolutely.
home than they did going to school. Although I'm not I'm not sure that it was really in their best interest to continue to be isolated, because many times those are the kids who need to get out and be more interactive.
Yeah. And I've
Mhm.
certainly seen some students who would fall into that category at the schools that I work at, because um they're thriving. They
Mhm.
had such
Right.
difficulty in the school setting where,
Right.
like the school year before, the
Mhm.
2019-2020 school year, um, the first half of it anyways, um, they would be sent home very often. They would get in trouble. There were lots of referrals and those kinds of
Mhm.
things. But then they go to e-learning, and all of a sudden they're doing their work, and
Right.
they are it's much easier for them to engage. So
Right.
absolutely.
Yeah, much more to their liking. But by and large, though, most students really have struggled. I think the biggest struggle was last year when things just shut down
Yeah.
completely for the last 9 weeks. I think that was really hard on everybody.
Well, and I think I agree. It was really hard. And what it did, I think, for a lot of students, and not that this is directly related, though it is, but for a lot of students, what it did is it set a precedent, students and families, it set a precedence for what homeschooling would be like. And,
Right.
you know,
Right.
in our area, for example, that last quarter of the 2019-2020 school year,
Mhm.
um, the expectations were almost nil.
Really
Um,
minimal. Right.
so the students, in fact, there was a policy that said that students in the fourth quarter there could not make a grade in any class lower than what they made in the third quarter. Um, and so a lot of students heard about that, and and it's because there wasn't a system here in place, and so we had lots of students who could not
Right.
access education at all.
Right.
And you had some that were, it was continuing okay. And so that whole quarter, there was very little work that
Mhm.
many students had to do. And
Right.
so it was easy.
Mhm.
And
Mhm.
so they were playing video games a lot. They didn't have to check in very often.
Right.
I think for them to be counted present for the entire week, all they had to do was check in with the teacher like one time.
Right. Mhm.
So as long as they like clicked a check mark, or they did an assignment, or they emailed the teacher or something, as long as they did it once a week, they were counted as present for the entire
Right.
week.
Right.
So the demands were very little. But then when this school year started, they were like, I'm gonna keep doing this.
Right.
Students were like, hey, this is easy. We can keep doing it.
Mhm.
But the expectations changed and returned back to, even if you're at home, the expectations the same as if you were in class, and you have to be face to face on the
Right.
camera every
Yeah.
day. And that's been really difficult for a lot of students.
That's right. That was a very different experience, and one that most students really began to chafe under that more restrictive, higher expectations.
Yeah.
And so, and you're right, what happened was, in the last 9 weeks of the last school year, school really got devalued.
Right.
And for kids who were sort of on that borderline between functioning and struggling, um, once the structure of school was gone, they kind of came apart,
Right.
because they had been using that structure of assignments are due on a certain day, and they're supposed to be in a certain place, and there's a certain expectation. When all that was taken away, kids who needed that structure, and we're not talking about kids who are necessarily mentally ill, we're talking about kids who took school seriously, but who needed that structure. How many times has kids said to you, I need the structure of going to school every day. I need to be in the building facing my teacher.
Right.
I can't do this
Right.
in a computer. It's just so different. It's so vastly different that I just can't adjust to it. And as one parent said, we were a high achieving household that expected good grades. Now it's just pass and be well. Grades really don't matter at all anymore. And these are kids some of these kids were high achievers. I've we have all had youngsters,
Mhm.
I think especially teenagers, but I'm sure it's affecting elementary school students
Yeah.
who were really good students
Right.
in the old system, in going to school every day system. They just couldn't make the adjustment to online schooling. They and their parents have opted to stay home for health reasons,
Right.
but it's not been good educationally because they needed that structure.
Right. And not just that it hasn't been good educationally, it's not good for a lot of kids, developmentally.
Hmm.
There's an interesting paradox when we think about anxiety and development, where when you have students with, say, social anxiety, or kids with autism spectrum disorders and things like that, their social skills are deficit, and they
Hmm.
struggle with social interactions. And so we think, oh well, homeschooling or distance learning would be ideal for them because they already struggle with their social
Right,
aspects. Well, all that does is perpetuate the problem.
right. That's
I
right.
mean, the treatment for social anxiety is to engage socially.
Hmm.
Um, the treatment for the social deficits associated with autism spectrum is to be social, to be with other
Right.
people, and to learn those skills, to build them. And so, while it may be intuitive to remove those kids from that stressful
Mhm.
stimulus, that stimulus is exactly what they need to get better.
Exactly what they needed. Right. Hmm.
So it's not,
Yeah, and
this whole thing has not been to their advantage at all.
right. And we all know, everybody knows that as kids migrated over the past decade, after they migrated to electronics
Mhm.
and away from person-to-person interactions,
Right.
we know that that's had
Mhm.
a negative effect
Right.
on their ability to interact. Now we have this, which further isolates them.
Right.
You know, not only truly isolates them in their own homes and away from their friends. But we all know too that there's been an alarming increase in kids' time on electronics. You know, there was an article published last week that's becoming a concern now because kids are at home and kids must have their devices on in order to participate.
Mhm.
But there isn't a clear demarcation between home and school anymore.
Right.
There was a time when they went to school, they weren't with their video games. Now we blended the two. For kids who are doing e-learning, there's no distinction between YouTube for school and YouTube for entertainment.
And man, it's I wish I could, people who are listening to the podcast wouldn't be able to see this, but I'll see if I can do it with my camera here. Um, I've logged into classes and so that I can do some observations and stuff like that. And there will be students. I'm going to see if I can move my camera so it does this, who will have their camera like that. So you can't see the student's face. You have no idea what they're doing.
Right.
But they show up as being logged in,
Hmm.
as being present, but they are, you can't see them. The teacher has no idea what they're doing. And a lot of those kids are playing video games. I have friends who are teachers who say, they will say something directly to the student. They'll even address the student directly.
Right.
The student doesn't respond.
Right. Right.
When you have a class of, 20,
Hmm.
25 students, you're not, it would be very difficult for a teacher to monitor what each of those students is
Right.
doing.
I
Um,
was working with a youngster the other day, and he was doing exactly that. And you could see his eyes going back and forth, obviously tracking something.
yeah,
And you could hear him typing. You could,
yeah,
you could hear the keyboard clicking
exactly.
while we're talking. And I knew he wasn't paying attention to me at all. He
Yeah,
was completely absorbed in whatever was on the screen. And
yeah,
it wasn't me.
absolutely. And it's a and so when the students, like you said, is doing that all day long, there's no demarcation between home,
Right.
recreation, and school.
Right.
Um,
Right.
and some of the schools are really working hard to try to deal with that by,
Mhm.
if that's the case, or if students have their cameras off, they're marked as absent, or
Right.
they're, something happens. But,
Mhm.
not all schools are doing that. And not
Right.
all teachers, even within the schools that are doing that, not all teachers are,
Right.
maintaining that, simply because, it's hard enough to deliver your material,
Right.
let alone trying to monitor all that.
Right. Yeah. So we know that, I mean, there was a review of studies, meta-analysis of studies, focused on isolation and loneliness correlated with increased depression in children and teens. So the research is in on that one, that this is really, social isolation is really difficult for kids. And it's more difficult for kids who are struggling with mental illness or are more likely to struggle with mental illness. And then there's another dimension to this, and that's children who are we talk about students of color. We know that the pandemic has hit Black and Hispanic communities more than it has affected white communities, but it's affected communities in poverty, regardless of race, because remember last year when we suddenly in 1 week had to move to online education, and suddenly it dawned on us that 30% of our students didn't have computers or internet connections. Right. They literally physically could not do online education because they simply didn't have the equipment necessary to do it. So that has some racial implications, but it's largely about poverty as well as race. And then when you add the George Floyd thing and the Black Lives Matter movement, that too exerts. So you have the pandemic, it's affecting Black and brown communities differentially. And then you have the killing of George Floyd and the Black Lives Matter movement. And then January 6th occurs, okay? And you have the storming of the Capitol. Well, for a lot of kids, that is scary stuff to watch hour after hour, to see the Capitol of the United States being attacked and destroyed by a mob. I mean, that's never happened in the well, it happened in 1812 or 1814, I guess, during the Second War with England, but it's never happened in history. And so you have all these events occurring, which is even more unsettling for kids who have trouble with emotional regulation.
Yeah, absolutely. And it just perpetuates because,
right,
again, kind of going back to that, what we talked about again on previous podcasts, the exposure of information, because students are informed through social media and everything of all these things. They hear their parents talking about all of these things,
right?
And then there's, they create, I guess we all create these microcosms wherein all we do is, sort of ruminate with others,
right?
Perhaps virtually ruminate with others to perpetuate our own perspectives. And so we take something that, even if you take a small idea, if you keep, ruminating over it and reviewing it and talking about it over and over again, that small thing turns into something really big. Right. And again, just when you don't have the opportunity to be exposed to other ideas, which is something that school does, you do have that risk of turning molehills into mountains.
Right. Exactly. Yeah. And, when you think of all that has happened in 2020, with the Black Lives Matter movement, the election, the storming of the Capitol, all that stuff that's happened in the past 10 or 11 or 12 months, and the way families are talking about these things, and the unsettling effect that it must have on children. And then they don't get to go other places to get that other perspective, especially to school or athletic. Wasn't you're coaching soccer? That was shut down for a long time, wasn't it?
Right. Yeah, it was shut down for a long time, and even within the school system here, there were periods of the school year so far already where they have completely shut down athletics for a period of time. So kids they're not even doing that. Right. And you got to feel for the teenagers who are hoping that athletics will help to be their pathway to college or to a career, right. And all of a sudden they can't play at this most critical time of their athletic career. They can't play, and so how do you get a scholarship?
That's right. Many high schools didn't have football season in 2020. Right, some did. So
when you think about here in our town, in Lakeland, we have a football program that is nationally
Mhm.
recognized.
Right.
And they weren't able to play all of their games.
Right.
And when they did play games, they didn't have some of their best players, and they didn't
That's right.
perform nearly as well as would be expected from their history.
Right.
And so you think about those students again who my goodness, I know that this happens a lot in the South and in Texas and some other states, but parents move to specific locations so that their kids will have those opportunities to play at some of these schools, because they know that that's going to be their best shot for their kid to have a career or to get to college. And so families make these big commitments.
That's right.
And then because of a pandemic, you can't play.
Right. There were families who moved to Florida from other states so that their children could play football here, because their town may have ended the season, decided not to have a season. And so parents moved to Florida or Texas where there was football so that their kids could play and get that chance at the scholarship. Yeah. So we have a pretty serious problem. One of the things that, and one of the reasons these articles were written was to tell us that there's been a 24% increase in emergency room visits for children with mental health issues. That was a 24% increase comparing March to October of 2019 compared to March to October of 2020. There's been a 31% increase for preteens and teens, so young children to teenagers. And what's happening is,
I think it's important to point out there, to go back to your starting point, where we were saying that the trajectory was already going up.
That's right.
So between March and October of 2019, there was already an increase. It was already increasing. And so in that same time frame, just a year later,
right,
in 2020, that trajectory was 24% higher.
Right.
So it was already increasing, and now it's increasing at an even greater rate.
At a faster rate. Right. And what's happening, the effect of that is that hospitals are running out of beds for children, and they're running out of beds in psych. Our country doesn't have an adequate supply of hospital beds or intensive inpatient facilities for children and teens. It's always been a problem. We never have had enough intensive inpatient services or facilities. Now those are exhausted. We have filled them up, and there are kids lying around in emergency rooms waiting for somebody to get transferred, because what happens is they're waiting for a hospital bed, but that means they have to get rid of somebody who's there, which means they have to find a place for that person somewhere. And in Florida, it may mean that you're in a hospital in Lakeland and suddenly you're getting transferred to Tampa just to make space for this other person who's languishing in the emergency room or in a hallway waiting for a bed. Okay. The other thing that emergency departments noticed is that typically there's a slump in admissions in the summertime. That slump didn't occur in 2020. Okay. The numbers kept increasing throughout the year, and there was no summer slump.
So we haven't seen the similar patterns that we've seen in the past. The things that tended to provide respite or just some relief have not been present over the past year. And we are getting up to, we're approaching the 1 year mark, right? Everything's shutting down. We're just about a month and a half away from that. So,
and one of the people they cite in the article happens to be a school psychologist who works in Louisiana, and their school system had more reports of suicide threats, more assessments for suicide in the first half of this school year than they had for the entire school year preceding this one. And so, again, that's another indication. Las Vegas, Nevada is in Clark County. It's a large school district. It's actually the 5th largest school district in the country. And they lost 10 students and 2 graduates, so 12 students from 2020 to suicide. They lost 9 the year before. So again, we see that we see this increase in really serious consequences of social isolation and the lack of structure.
Right. Well, and again, looking at those numbers, that was 12 students that they lost in the first half of this school year compared to 9 in the entire school year before.
That's right.
If you continue that,
if those numbers continue,
losing more than twice the number of students that they did.
That's right. Almost a factor of 3. Yeah. Mm-hmm. And so when you think of the numbers, it does raise really serious concerns. The other thing to remember, we have this sort of a couple of other points. We put them under other factors. For teens, their peers now are more important than their parents and their family. Right. That's where you connect, and that's a normal developmental event, is that your life now is revolving around your peers. When you can't see them, again, that's taken away. Right. And you're spending all this time with family members rather than with your friends. So not only do you not get a break from your family, that break that we talked about earlier, where, let's everybody get out of the house and get away from each other and then come back together, but you also are missing that critical social interaction where teenagers learn how to interact with each other by being in a school setting, by being around other teens.
Right.
Imagine not being able to see. I can't imagine what it would have been like, right, not to be able to go to school every day.
Right. Yeah, it's difficult to imagine, right, what that would have been like.
Mm-hmm. Right. Also, we talked about not having breaks from family members, but there's another thing, and that is that when students do come in for therapy, the infection control precautions really get in the way of establishing a therapeutic relationship. Doing this online is very different from doing it in person. Doing it in person with masks is very different from doing it in person without masks, because you can't see a person's face. And as a species, we have come to judge the emotions of others by facial expression. Well, we've taken away facial expression by covering it with a mask. So it does interfere with therapeutic relationships.
Absolutely.
Right.
Absolutely. Which makes therapy more difficult, which makes, those students who are in therapy, maybe, they tend to, or perhaps they're not benefiting quite as much as they otherwise would.
Right. Yeah, you don't want to take your mask off to show them that you're really unconditionally supportive. But you really are tempted to do that. So saying, look, I really appreciate what you're telling me right now. Right. And you can't do that. So it impedes the therapeutic relationship, and you're just not as effective as you might have been.
Absolutely.
Okay? And then, of course, the last issue is the whole issue of domestic violence and physical and sexual abuse. We know that abuse, with all the tension and pressure, we know that the incidents of abuse are increasing.
Right.
But kids not going to school, kids not being out, being seen by their friends, being seen by their teachers, we're not as aware, and rates are not, and it's not being reported. Right. So rates have declined. Rates of report rates have declined. We know kids are being abused, but nobody can do anything about it. And there was a little anecdote here about a kid who was in a Zoom class, a student who was in a Zoom class, who I guess typed out, "I don't feel safe in my house," was the only way he could communicate to his teacher that things were not going well.
Yeah, because it has been surprising in my time working in the schools how frequently it is that a student will report, and that's the only place that they report because of the connection they have with their teacher or someone else at school. that's where you get that information. That's where you learn about some of these students who are struggling so much.
That's right. What would a 10 or 8 or 9 or 10 or 12-year-old kid do? That it's only by going to school. They can't go anywhere else. They're not going to go to a police station or fire station. They go to school to report. Or teachers see the signs of abuse, black and blue marks or cuts or scrapes or whatever, cutting, all those self-harming behaviors. They're hidden now. Kids are staying home and teachers aren't seeing it. So, and that's another huge advantage. So kids with mental health really are isolated now in ways that they hadn't been before. And it's making matters worse. So we have more mental health, more severe mental health issues.
Absolutely. And so it is important to remember, sort of the overall picture that we're trying to paint here is that, there is this massive issue that we're not, we're really focusing on, the vaccine and the treatments and the numbers, the prevalence rates and all that kind of stuff. But there is this silent tidal wave that we have not recognized that is coming, and has hit in many places. That is this massive increase in the mental health need, especially of children and teenagers in our communities, and we need to be paying attention to that, and parents need to be more as in tune with that as possible.
That's right. Yeah. What the fear is here, I guess there are two fears. One is that now that we're aware of this, this is the tip of the iceberg. I mean, there's so much more going on. We know about this because it's being reported. What about all those kids who haven't been in school now for a year, almost a full year, that they have not been in a school building or nor have they been seen by other adults. And so we're just seeing the tip of the iceberg. And the other thing is that these aren't going to disappear. Let's say schools completely reopen in the 21-22 school year. So by August of next year, these problems are not just going to go away with the reopening of schools. They're going to persist. They're going to persist across at least the next school year.
Absolutely, yeah. And it's this entire process, the entire experience of the pandemic is creating new problems that we have only just started to see. I had a kid the other day that I was working with who, presents with a severe anxiety whenever he sees someone not wearing a mask. Something that, we would have never experienced before.
Never would have been an issue.
Now, all of a sudden, he has this acute reaction whenever he sees someone not wearing a mask. And so, yeah, it's there's going to be a lot of work to do as we recover from all of this.
I think about those kids who were doing well, and we've all seen these kids in our practice who were doing just fine, getting really good grades, and then the last quarter comes and schools shut down, and their grades drop, and they haven't been able to re-engage adequately. And so their GPA, these are high school kids whose GPAs have really suffered. And it's going to have long-term effects on their college choices and selections and what courses they take in the coming school year, because they've been underperforming for almost a year now.
Absolutely. It's a travesty for many students.
Yeah, it's going to be tough.
Yeah.
All right. More bad news. No, we need to be aware of this stuff. The pandemic has tentacles everywhere, and this is yet another tentacle that we need to be aware of.
Absolutely. All right. Well, that is it for today. Until next time, stay happy, stay healthy, and forget to be afraid.